Welcome back to Preserve Health Talks. I'm Dr. Ira Pearlstine, your host, and my co-host, Leah again. Good morning, Leah.
Good morning.
Well, guess what?
What?
It's Friday,
It is.
and we have two special guests this morning who we're really pleased to talk with. They're opening a new practice, aesthetics and primary care. They've named it The Collective. So I want to introduce to you and to our audience Dr. Alexandra Snyder and Liz Del Rossa, physician assistant. Good morning and welcome to our show.
Thanks for having us.
Good morning.
So tell us about The Collective. How did this collaboration between the two of you come to life, and what inspired the name?
So Liz and I met about 5 or 6 years ago working in the emergency room together, but it wasn't until we both became moms and had small kids of our own where we really started to chat and bond with each other.
I think we quickly realized in our bonding how hard it was for self-care, and it just really took the stars to align to be able to make those appointments for yourself. So we formed the collective based on our vision, a shared vision of making self-care more accessible for other busy moms and working women, and we to just empower us to be able to make those appointments, to get self-care and kind of combine both our health, our wellness, and overall medical needs.
Great name.
Thanks.
So you both come from strong clinical backgrounds. What made you want to shift into aesthetics, and how has that transition been?
I think, the shift to aesthetics has been an easy one, really. The strong clinical background is something that helped both of us. When you think about aesthetics, you think about fillers and Botox, and really there's so much more to it. And, you can go out and get all those treatments you want, but if you're not taking care of your inner self and, knowing how your body works and what's going to give you the best results, then it's just not going to have the greatest outcomes. So I think our backgrounds have really helped us both procedure-wise and, helping make aesthetics, about the whole person.
And I think we both are just kind of at that age where you start to look at yourself in the mirror and you start to notice things like dark spots on your face, sun damage, sagginess, things that weren't there before, and you just kind of start to feel like, oh, I'm getting older.
What's making this happen?
Yeah, and not everybody wants to go and get a ton of Botox and fillers, but we were really interested in what can we do to just keep ourselves looking fresh and young and not necessarily look like we had anything done.
And they think they're at that age. I'm definitively at that age. So I know you offer a lot of aesthetics, Botox, fillers, and Botox and fillers is only a small part of the aesthetic world. What else do you offer?
I think what we really fell in love with when we started this route was the regenerative part of aesthetics. We offer a lot of what's called PRF, or platelet-rich fibrin. We're taking your blood, we're spinning it down, we're taking the platelets and the growth factors out of that, and we're injecting it back into the skin. Without getting too scientific, there's a lot of regenerative properties to that. We're restoring collagen, we're helping the elasticity of your skin, and just giving an overall natural, youthful appearance.
And the second part of that question is, you also offer primary care. How do you balance those two worlds, and how will they complement each other in your new practice?
I think those two things go hand in hand. Like I had mentioned a little bit ago, when you think about aesthetics, you're not going to get the best results unless the patient's extremely healthy. When somebody comes in, you might come to us for Botox, but we're going to look at your overall self and what else do we need to improve. Are you sleeping? Do you have good hygiene habits? Have you had your blood work checked recently? Why do you have these dark spots or this redness on your face? So those are all things that we can kind of dive into as offering both primary care and aesthetics.
So there's a lot of aesthetic practices out there. What sets you apart?
So, again, one of the things that when we shared this vision and opening our own practice is we wanted patients to feel very warm and welcome. When you walk into a med spa, at least for myself, I sometimes would feel very out of place. It was intimidating. I didn't know what I wanted. I knew what I wanted to look like. I knew what my problem areas were, but I didn't know what to ask for. And I would look at these beautiful girls standing there with a needle in their hand ready to inject my face, but I was so intimidated. Yeah. I don't ever want a patient to feel that way. I want you to come in. I want you to have a cup of coffee. Come just talk, hang out. Tell me what your goals are, and together we'll come up with a plan to help you.
Yeah.
Don't ever feel, there's a price range for everybody, and we serve every age group.
Yeah, and it's not just a one and done treatment. Before we started to get into this, I didn't know what kind of treatments I needed. Maybe I saw a friend who went and had a certain service, a microneedling session or something, and it's like, oh, I want that too. And you go and you have the treatment and you leave and that's it. And, there's no maintenance. But, if you want to, for example, maintain muscle mass, you have to go to the gym, and not just one time. It's something, that
You need to maintain.
Yeah, you need to maintain. And it's the same thing with your skin. So we're really looking to talk to people about their long-term goals and how we can get there, and kind of tell them what treatments would work for their skin and how often apart do they need to be. So we're just looking to kind of get clients that are going to stick with us for the long term.
And I think the primary care aspect is also really unique.
Correct.
That you're just not fixing what's on the surface, but you're diving deeper.
Correct. And I think it's another thing too, it's so hard to find primary care. And again, as busy moms, it was hard to not only find primary care, but self-care as well. So if we can combine those services in a one-stop shop, and, you can come relax, it's a safe place where you can just sort of unwind and get the help that you need and what you're looking for. It's really what we wanted to create.
I know people out there are asking, where do I sign up? How can I see these people? It's going to be at the bottom of the screen in just a second, and you'll be able to give these folks a call, and they'll help you. South Florida, it's so much overdone with cosmetics. And you go down further south into the Palm Beaches, and everyone has that surprise look. I've been out in the wind, but that doesn't change when you come indoors. And you want to avoid the element of surprise look on your face all the time with overdoing it, the classic old 1900s facelift. So how do you differentiate between natural enhancement and the overdone results? And for you, how do you help patients determine that sweet spot?
So, Liz and I, we take a more natural approach, I would say. We want to enhance someone's natural beauty. If someone comes in and they want the biggest lips possible, or, just a dramatic change to their face, maybe we're not the best people to see for that. Maybe you'd be better suited going somewhere else. But there's a lot of people out there that don't want to look like they had anything done. They just want to feel good about themselves and stay looking refreshed and young. And, that's really, our ideal client, I would say.
I'm going to have to schedule an appointment with you very soon.
The door's always open.
You're both women in medicine running your own business. That's amazing. What's been the most rewarding part of this venture so far, and what's been some challenges?
I think just that we're both women in medicine running our own business. To me, that's been the most rewarding, I think, to both of us. Some of the challenges, obviously, as, toddler moms, and when we started this, full-time jobs and families and husbands, try to balance everything. So it's definitely a challenge, but it's also what led us to the collective, and trying to kind of mesh that and make it more accessible for other women in our same boat and during this phase of life.
Yeah, and I both truly feel that we love this so much that this doesn't feel like work for us.
That's correct. Yes.
When I was in my training decades ago, I had an attending tell me that good judgment comes from bad judgment, which comes from experience. So what advice, as now experienced in setting up your own practice, would you give to other clinicians, especially female providers interested in starting their own aesthetics or hybrid practice as you're doing?
I mean, I would say just follow your heart and do what makes you happy.
Yeah. And I'd also say too, I've wanted to do this for about 17 years. Tells you when I started in medicine, but I never wanted to open that door. I was always afraid to open door number 2. And it wasn't until I met Alex and we shared this vision that it really gave me the push to open that door. And so I would say if you never open door number 2, you never know what's behind it. And as Alex mentioned, this doesn't feel like work. We absolutely love what we do and we can't wait to meet, those in our community and help them feel the same way.
So the collective, the numbers on the bottom of the screen, Dr. Alexandra Snyder and Liz Del Rossa, we're going to wrap it up with one last question.
So what's one thing you wish more people understood about aesthetics or their health in general? And how does the collective aim to educate and empower your patients?
I think those things, as we mentioned before, those things definitely go together, right? So your results are only as good as you are within. So if I was to tell anybody coming for any aesthetic procedure, it's you really need to take care of yourself overall, right? We talked about good sleep, good eating habits, exercise, avoiding excessive alcohol, all those things that sometimes you can kind of get wrapped up in and forget about taking care of yourself. And so this is not a quick fix. This is something that Alex and I, when we meet these patients, we really want to form a relationship with you and move forward, taking care of your whole body, not just your face.
And, a lot of people, don't take action until essentially it's too late. People, don't address the fact that they have cardiovascular disease till maybe they have a heart attack or get stents. Really you need to address your lifestyle and your behaviors, your risk factors, in your 20s, your 30s, your 40s, not when you're in your 50s, 60s, 70s, 80s, and you've already had years of damage. Same thing with, your skin as well. You want to, start taking care of yourself in your 20s, your 30s, use medical grade skincare, have a sunscreen, have a regimen. It's much easier to prejuvenate than to try to rejuvenate.
Nicely put. Leah, you think we should have them back on the show and see how
Absolutely.
they're doing a couple months from now?
Absolutely.
Would you like to come back on the show?
Yeah.
Sure.
We'd love to have you back on the show.
And we can't wait to stop by and see some of the services that you guys offer.
I know,
Absolutely.
change our looks.
Yeah.
Thank you for joining us for another episode of Preserve Health Talks. We'll see you again soon.